Good morning. My name is Dr. Issa Abdulmujib. You are welcome to your health guide segment. And today we shall be looking at anemia. What is anemia? Anemia is short of blood or low blood level. Anemia can be caused by different things, different factors that are responsible to the cause of anemia. And an individual, if you do not know the cause, you cannot know the treatment. So you need to identify why is your blood level low. Number one is that when we are born as an individual, so many organ or part of our structures were involved in blood production. So if this part of the body involved in blood production got reduced in the ability to produce more blood, then our blood is going to be short. Number two is that loss of blood. Now, if you happen to have a normal blood and suddenly you start bleeding, and this bleeding can be on account of road traffic accident, you sustain a very big wound and you're bleeding profusely. So what will happen to you? Your blood level will go down. Or you had a surgery and then you're bleeding in the process, it's going to go down. Or you have cancer, a cancer whereby you are losing blood inside because the cancer cell depends on your blood system. So your blood level is going to reduce because it's reducing the blood volume in your body. Or a woman that is having menorrhagia, that is a menstruating and excessive bleeding, this also will lead to blood loss and so our blood will go down. If you have ulcer that's bleeding whereby you have been bleeding inside, this also can lead to low blood level. If you're involved in fire incident and you're a little bit burn, your blood level is going to go down drastically. So all of this can cause blood loss and it can reduce your blood level. Again, number three is hereditary factors. There are some things we inherited from our parents that can actually make our blood to be low. For instance, if you have a child that has hemoglobin SS, sickler, they tend to have low blood that make them to suffer a lot of crisis. So low blood level, this to a hereditary factor. Or there's a disease called thalassemia alpha or thalassemia beta. So if any of this is also present, this individual is going to have low blood level. So not only that alone, number four, nutritional factors. If for any reasons you are not eating well, you're not eating adequate food that will produce blood in your system, your blood level is going to go down and so on. So the number five factor that can actually make your blood to go down is one, if you have what's called bone marrow depression. Now the bone is actually involved in blood production. So your blood level comes up if your bone are working very well. And this is one of the reasons why we tell people to donate blood, so as to activate your bone to remain active all through life to very old age and continue to produce blood. That can happen if the bone is depressed. And factors that can depress the bone are numerous. Infection. So some viral infection that can depress your bone and therefore it will not be able to produce a lot of blood level in your system. Kidney failure. If you have a problem of kidney, this also be a factor. And then if you're taking chemotherapy for cancer disease, your blood level is going to go down. So what are the signs? The signs are very basic. Now let me give you like a few ones. The person starts getting tired, shortness of breath, feeling dizzy, and start feeling that his heart is beating very fast, and sometimes have a headache, and he's pale, his body is looking pale and look very sick, sometimes confusion and can lose consciousness. So how do you treat something like this? You get to understand that you must identify the causes. See all the numerous causes I gave you. If you don't understand the causes and you're taking any treatment, you're going to cause injury to yourself. A lot of people take blood tonic for why they do not need it at all. And some people that are older and take blood tonic in excess, they eventually cause another injury to their system called hemosiderosis, whereby their liver gets congested. So until I meet you again, follow the health guide and enjoy your life. Stay tuned. Do not go away. Breakfast show continues.